You walk into a room and forget why. You start 10 things and finish none. You wonder, is this just menopause or is it something else? Turns out ADHD symptoms can worsen during perimenopause and menopause. But here's the part no one tells you. Your hormones may be contributing. So it's not just about medications. Hey, I'm Dr. A and I'm an integrative psychiatrist. Before we get started though, let me ask you this. Have you always been a little forgetful or scattered? But suddenly, it's like someone's turned up the level of your brain fog? Well, there's a reason you felt that way. Estrogen plays a massive role in your brain's dopamine system. And dopamine, that's the motivation, focus, and follow through brain chemical. So when estrogen drops in perimenopause, this can affect how your brain interacts with dopamine. That's why even women who've never been diagnosed with ADHD suddenly feel like their brain is falling apart. In fact, studies show that many women are often diagnosed with ADHD for the first time in their 40s or 50s. Not because they just developed it, but because their brain was coping until their hormones started declining. A 2021 study in the Journal of Women's Health found that over 30% of women newly diagnosed with ADHD were in perimenopause. And here's the kicker. Doctors usually miss this entirely. You get told it's just aging or just stress, but there's more to the story. Now, when it comes to treating ADHD, especially in menopause, medication can be a powerful tool, but it's not a one-size-fits-all. There are two main categories of ADHD medications, stimulants and non-stimulants. Stimulants are generally regarded as first-line treatment, while non-stimulants are considered second-line. Stimulants are the most commonly prescribed ADHD medications. They increase dopamine and norepinephrine, your focus and drive chemicals. There are two main types, amphetamines like Adderall, Vyvanse, Eviq, and methylphenidates like Ritalin, Concerta, and Focalin. The advantages of stimulants are they have a rapid onset, usually within 30 to 60 minutes. They are also highly effective. 70 to 80% of adults with ADHD benefit, and they improve attention span, reduce impulsivity, and increase task completion. They may, however, cause anxiety, insomnia, or palpitations, raise blood pressure and heart rate, suppress your appetite, and some women may feel emotionally blunted or disconnected on higher doses. And here's what most doctors miss. Your estrogen levels change how your body responds to stimulants. When estrogen drops, you may metabolize meds more slowly, leading to more side effects or less effectiveness. So if your meds suddenly stop working or feel too strong, it could be your hormones, not the medication. Apart from stimulants, we also have non-stimulant medications. These are helpful for women who are sensitive to stimulants, have high anxiety or insomnia, or don't want to take a controlled substance. Examples of non-stimulants are Strattera, Effexor, and Wellbutrin. Intinib and clonidine are primarily used in kids. The generic name for Strattera is atomoxetine. It is an SNRI which is not habit-forming and can help with focus and anxiety. It has no crashes, irritability, insomnia, or many of the side effects with stimulants. It is, however, slower to kick in and can take 4 to 6 weeks to feel the full effects. Side effects may include nausea, dry mouth, fatigue, or dizziness. It may also decrease libido in some women. Wellbutrin is an antidepressant that also improves dopamine and norepinephrine levels. Its generic name is bupropion, and it is used off-label to treat ADHD. It boosts motivation and mood, so it's great if you have ADHD and low energy. It's not a controlled substance. It acts as a mild appetite suppressant. Because it can enhance libido, it is often used as a replacement or add-on to SSRIs. Wellbutrin can, however, trigger anxiety or jitteriness in some women and may worsen insomnia if taken later in the day. It's not ideal for those who have severe distractibility or impulsivity. Effexor is another non-stimulant used to treat ADHD off-label. It is an SNRI antidepressant that helps with depression, anxiety, attention, and even hot flashes. It can, however, increase blood pressure and cause emotional flatness, headaches, dizziness, and sexual side effects. Because it has a short half-life, withdrawal can be tough and uncomfortable. You must taper this medication slowly. So yes, there are medications you can take for ADHD, but remember that you'll always feel feel better when you address the root cause and apply lifestyle tenets. Here are 5 evidence-based strategies that can help with or without medications. Number 1, balance your hormones: estrogen, progesterone, and thyroid hormones. Estrogen affects how your body responds to dopamine, so when it drops, your attention and focus may suffer. Menopause hormone therapy can be a game changer for some. One study from the Menopause Society found estrogen therapy improved ADHD symptoms even without stimulants. Of course, hormone therapy is not for everyone. It needs a personalized risk-benefit discussion. I made a video on this earlier. Number 2, heal the gut-brain axis. Your gut significantly affects how your brain works, especially during menopause. A healthy gut helps your body make essential brain chemicals like dopamine and serotonin, which helps you focus, stay calm, and feel good. But when estrogen drops in menopause, it can throw off the balance of good bacteria in your gut. This can make it harder to think clearly, control emotions, and stay focused, and can make ADHD symptoms feel even stronger. The good news is that you have the power to help your brain heal. Eat fermented foods like sauerkraut and kimchi. Get 25 to 30 milligrams of fiber daily. Eliminate ultra-processed sugars and seed oils. Support your gut lining with magnesium, glutamine, and omega-3s. Number 3, structure your day and use systems that stimulate your brain. Structuring your day can make a huge difference when you're managing ADHD, especially during menopause. Start with simple systems that give your brain both order and stimulation. Try using the Pomodoro cycles. Work for 25 minutes, then take a 5-minute break. Begin your mornings with a quick brain dump or a to-do list to clear mental clutter. Use color-coded calendars, planners, or whiteboards to stay visually organized. Keep things fresh by rotating your workspace or changing your playlists. ADHD brains thrive on rhythm and novelty. When you create a daily flow that builds in both, focus and energy become much easier to maintain. Number 4, movement. This is one of the fastest ways to boost focus and brain power. Exercise isn't just good for your body. It helps with dopamine and BDNF, which is like fertilizer for the brain. Just 20 minutes of brisk walking can sharpen your executive function, helping you plan, organize, and stay on task. Add resistance training 2 to 3 times weekly to build even more cognitive strength and resilience. But don't overthink it. Dance, hike, swim, lift, bike, whatever feels fun and keeps you coming back. When you move your body, you wake up your brain, and that's how you move toward focus and energy. Number 5, recharge your mitochondria. Your mental energy comes from tiny power plants inside your cells called mitochondria. If you want better focus, mood, and stamina, you must take care of them. Start with sleep. Aim for 7 to 9 hours a night. Keep your room dark and wake up at the same time each day. Fuel your mitochondria with foods like berries, leafy greens, and healthy fats. You can also support them with supplements like CoQ10 and magnesium. When your mitochondria are working properly, that translates to better overall brain function. In addition to the above, ADHD coaching is something to consider. It helps by providing practical support for organization, time management, goal setting, and problem solving. Coaches work with you to identify your unique challenges, build on strengths, and develop systems to manage daily life more effectively. CBT for ADHD is also beneficial. It includes goal setting, task management, cognitive restructuring, and mindfulness. Also, behavioral interventions and skill development for emotional regulation and impulse control. So, treating ADHD isn't just about adding pills. It's about taking a holistic approach to treatment, including hormones,